shows the need to have a worldwide discussion, an in-depth discussion about this issue.
Was it easy to advance this debate, this discussion, during your tenure as Secretary General of the United Nations?
Well, it wasn't at the center. It wasn't at the center of discussions. The UN drugs program is based in Vienna, and most of the discussions take place there. You often have attorney generals, chiefs of police, and others going there to have discussions. But it's moved up the political agenda now, and I don't think we can push it back. And I think it's important that seriously.
Kofi Annan is touching on a real problem at the international level, in that drug policy is discussed by the law enforcement people in Vienna. And we need to stop viewing it simply as a law enforcement problem. We need to look at it as a public health problem.
Exactly.
And the question is, it does some harm, drug use, but the fight against drug use using criminal law does enormous harm by ruining people's lives, by putting them in prison, but also, we haven't talked that much about this, by fueling the market that creates the drug cartels, where you've had, 25,000 people disappeared in Mexico, 100,000 killed, and these are people killed not only by
the displaced,
and it's not only by the cartels, but it's also then by the military response to the cartels. You have a virtual war going on, along the U.S.-Mexican border, and this is very much a product of the market that criminalization has created.
I think this is the perfect time to transition into this issue. Just last week, the Surgeon General in the United States said that 8 million deaths, 8 million people are still alive, basically, thanks to the war on tobacco. So a little bit over 50 years ago, the first report from the Surgeon General came out in the United States, and it said that it warned about the dangers of tobacco. So here we have a public health issue being dealt as a public health issue. And higher taxation, limits to where people can smoke, limits to the advertising of tobacco.
And no criminalization.
And, of course, no criminalization. 50 years later, 8 million deaths have been prevented. And I'm not saying we've solved that issue, but I think we've come a long way. On the other hand, you have prohibition. Pretty much the same time frame, a little over 50 years. And that has brought about more production, more consumption, and more people dying because of this police approach to it. A public health issue being dealt with as a safety public issue. So isn't it time to take action? Is it a fair comparison?
Well, this is why I'm asking for us to take a serious, honest review at the policies as they exist today and look at the history. And you've provided examples on alcohol and prohibition, the impact. And we have enough, even if we don't have it globally, we have enough in key countries to be able to make a judgment as to whether the policies we have today are working and why we should change them.
And what you're outlining is that you don't have to just throw your hands up and say drugs have carte blanche when you decriminalize. You can be quite aggressive in discouraging use through education, through opiate substitute programs. You can bring in needle exchange programs freely, which prevent HIV distribution. I mean, there's a lot you can do through education, treatment, and public health measures that would discourage use without ruining lives through criminalization and fueling the violence that criminalization is.
And the example in Portugal and all, where they've done this shows a good result.
So it's a good example. Public opinion seems to be behind this around the world. But you have a re-election coming up.
Public opinion in general, if you ask people, do you want the drugs to be decriminalized or legalized, in general, they say no. Why? Because they understand that the drugs are bad, and nobody, I think, disagrees that
legal or illegal
drugs are terrible. They poison your kids. But the issue has to be looked at in a more comprehensive way. And when you weigh the pros and cons, then and you are able to explain, for example, on the human rights, from the human rights perspective, simply by taking away those huge profits that go directly to these gangs that are multiplying by the day in Central America and South America. We're starting to have really big problems in Brazil, in Argentina, all around. They're growing. To take away those huge profits. Simply to do that would be an enormous, enormous benefit for humanity. And you go to Afghanistan, or you go all the corridor from the Middle East to Europe.
Right.
I was in Spain yesterday. The Spanish consumption is going up. The UK, the consumption is going up. But the profits from drugs are also going up.
So they're becoming more powerful. Governor Perry, during the last week, President Obama, the majority leader in the Senate, Harry Reid, and Republican Governor Chris Christie, they all talked about marijuana legalization. So there's political momentum in the U.S.
Yeah.
Do you want to jump right into that?
Notwithstanding the two politicians on the dais here, we'll take ourselves out of the picture, because we certainly would never jump out in front of a parade just because that's where the public sentiment seems to be going.
Right.
But the fact is, I think it's very important for science to continue to play a most important role in this before we jump to some conclusion, before we run out and get in the front of a parade that's going somewhere because we think that's where the public opinion is. And I want to share just one thing, or make a response to the Secretary about Portugal and the legalization of drugs there. In the 5 years since that has occurred there, 40% increase in the murder rate in that country. So now, again, anecdotal, I totally understand it, but the fact is we need to look at all of the data, the science. The young Congressman Kennedy lectured the president a little bit on his remarks about marijuana that he smoked as a young man, and alcohol is basically the same. And Kennedy said, Mr. President, do not make the mistake that the marijuana that was used 30 years ago is the same today as it was, or that is today. Genetically improved, incredibly potent drug. So again, science needs to be front and center before we make any decisions at the level of the legalization or even the decriminalization of some of these substances that we're talking about.
But nonetheless, I mean, decisions are being made. 22 states have legalized medical marijuana in the U.S. 2 states have recreational use. Now New Hampshire can become the first state to legalize marijuana through their legislative branch.
And you know that I am a staunch proponent of the 10th Amendment, that the states need to be given substantially more authority in making decisions, whether it's on their health care or whether it's issues like this. And then the people will decide where they want to live, whether it's economic policies or whether it's social policies, the issues of traditional marriage or abortion, and the restrictions of abortion. I might limit at that. But those states, according to our Constitution in the United States, should be allowed to make those decisions, and not this one-size-fits-all mentality that we seem to see coming out of Washington, D.C. today.
You want to say something?
There's one other issue that I think is important to mention here. This is the perfect example of where the balloon effect becomes effective. Colombia. We have managed to reduce the production of cocaine 60%. Right. We were able to dismantle the all-powerful cartels. They were invincible, according to the world press. All of them are, drug lords are dead or in jail. We have been very successful in destroying the labs and the chains of marketing. We still have the problem. But what has happened? Central America and the Caribbean and Mexico are in flames, and our neighbors are now producing more than Colombia. So the balloon effect is really working there. So that's why I insist that we must approach this problem multinationally, all the world if possible, because otherwise it will go from one place to the other. We went by the book. The war on drugs, according to the United Nations, was applied in Colombia perfectly. And look what happened. This is a perfect example of something that doesn't work very well, and that's why we need, all of us, to have a new approach.
Kenneth, before opening up the questions to the public, are we moving at a fast enough pace? Because we've been talking about the need for a new approach for a while now. Now we have more voices, important voices, coming into this debate. We have a debate here in Davos for the first time, but are we moving fast enough?
Well, obviously, I want to see things move more quickly, but there's been, very good experimentation in the United States. I agree with Governor Perry that we want to let the states experiment, and I think the federal government has wisely backed off. And so, with the handful of states that are now decriminalizing marijuana use, they're saying, okay, as long as within some limits, we'll let you do that. And that's a healthy approach. I think we want to see that kind of experimentation taking place at the international level too, which means revising the drug regime in Vienna. Because the international treaties are terrible in this area. And we've got to interpret them in a way that allows for this kind of experimentation. Because, frankly, as President Santos says, this balloon effect is real. And the reason for it is the massive draw of drug profits, which are a direct consequence of criminalization. The way to stop the balloon from simply shifting is to puncture it. And you puncture it by destroying the market. You do that by decriminalizing, and suddenly there's nothing left for the cartels.
Let me just inject there and ask you and the panel's opinion, because we talk about the monetary aspect of this. What is the answer from the standpoint of the banking industry's responsibility in this issue? Because the fact of the matter is, if you're not able to launder these dollars and you use them in other ways, it becomes somewhat of a negative impact upon the drug cartels. So what is the responsibility of the banking industry in this issue?
Let's follow the money for her.
I'll answer that. One of the difficulties we have had in Colombia for many years is that when we go after the money, suddenly there's a wall, and you cannot penetrate that wall. The secrecy of the banking industry is one of the impediments to be more effective in going after, especially the money. When you fight the chain, the price goes up link by link. Right. If you go the most expensive, but the least effective is going after production. If you seize the cocaine when it's in the U.S. market, for example, it's much more harmful to the chain.
Because of the margins of profit.
But the most successful is when you go after the money. And there we have a bottleneck.
And we don't hear a lot about banking institutions paying the price for laundering money. Recently, I think it was HSBC that was penalized for it. But is there also something to be said about the financial institutions?
I haven't really looked into that, but obviously it's an important aspect. But nothing of what we are discussing here is going to be easy to do. And we should expect difficulties. And it's also, we focused a lot on the US, right. But it's not a US problem alone. It is a global problem. Right. We need to educate the public. We need to educate families, and they themselves know drug is a bad thing for their children. They will resist. But we need to have a serious public debate that leads to serious reform of the drug regime, starting including the international regimes that govern this. Because if we look at the difficulties alone, we cannot do much. Right. And even the movement in the US regarding marijuana, which is a step in the right, it's only a step. There's much more to be done. How do we organize ourselves as an international community to ensure that enough countries and enough momentum is created to really break the back of this drug problem once and for all? You talked of the Caribbean and others. They are moving to West Africa. The drug cartels moved to Guinea-Bissau, using the West Coast through the Sahel to get drugs to Europe. One of them flew a Boeing 707 to Mali, offloaded the goods, and burnt the plane. It shows you the margin. If you can burn a 707 and still make profits, the margins they are getting. So the tentacles are quite wide, and I agree with Richard that we should also start looking at the international regime.
In your experience,